So hello YouTube, how is everybody doing? Trust you've all had a wonderful weekend. So today we're having a special edition. I have on the set today Dr. Tosin from Dr. Tosin on YouTube. So check him out on YouTube. He's an old friend of mine. We went to school together. We've known each other for almost 30 years now, and then we go way back. So Tosin is on board to help us understand some things from a medical perspective. We had questions come to us from the other video I did about high blood pressure. So Dr. Tosin is going to help us answer some questions that were asked. So Tosin, you're welcome on board. Thank you for coming around.
Thanks, David, for having me. And yes, glad to be on the channel, man. This is really something. Looking forward to doing my best to answer the questions. What's up, YouTube? Like he said, my name is Dr. Tosin, and I have a YouTube channel as well called Dr. Tosin's channel. Pretty much that's what you search. And just a quick brief history of what I do. Medical doctor based on family medicine. In the UK, that's called general practice. And what I focus mainly on, apart from the general practice, I prefer to help, well, not prefer, I am keen to help over 40 men achieve good health, and women as well. I am keen to help people achieve peak fitness, which involves things like weight loss, healthy living, and resetting their metabolism. Right, sure, going back to you.
I like how you said it, resetting their metabolism.
Oh yeah,
so this is just a good nexus for two of us. My channel is 40 Feet on Fun. You have a passion to help people who are over 40. So well, I believe that people are going to be blessed by our collaborations going forward.
Most definitely.
So let me go straight to the question. The first question is, sir, please, how can you be of help? I did not have high blood pressure until I was pregnant. I developed it, and they call it pre-eclampsia. Can you help me to pronounce that? I don't know how to pronounce that.
Oh yeah, I think that one is pre-eclampsia.
Okay, pre-eclampsia. Okay, please, how can I normalize my blood pressure now? That's the first question.
Yeah, so I'm presuming this lady has just given this, definitely a lady. The pre-eclampsia happens in only women. And it's a condition that leads to your blood pressure being elevated during pregnancy. It starts around the 20th week of pregnancy, and it comes with some other factors in it as well. Now, one of the theories behind it is that it's linked to the placenta in the mother. Well, not the placenta of the baby and the mother causing the blood pressure. There's a big theory behind it, but I am not an obstetrician that can go into nitty-gritty details. But coming back to this person, I think I'll need her to get some more checkups and find out, one, has her blood pressure stayed high after delivery? If it has, they might not necessarily still be pre-eclampsia. We'll now have to assess her for things like high blood pressure and hypertension, which will involve questions around her health, her lifestyle, her family. Now, if that's the case, addressing it will be multifactorial. I like to approach things from the healthy perspective first. How's her sleep? What's her nutrition like? Is she exercising? Are you overweight? Big thing, very big thing. Those are the key things I like to address first. If she can, my advice would be seek help from a specialist. It may be that if it's persistently high, and when I say high, the cutoff figure that we use nationally is a figure above 140/90 in the clinic, or 135/85 if you're doing it consistently at home. So for her, the short answer is look at your lifestyle, look at your nutrition. How fit are you exercise wise? What's your weight? What's your BMI? And seek help from a specialist. You might need to go on some medication to help bring the blood pressure down.
Oh, thank you so much, Dr. Tosin. So now, Tosin, you just said something very key. If you are taking your blood pressure readings at home and you are getting above 135 and 85, you should be concerned, right?
Yes.
And if you are taking your blood pressure at the hospital and you're getting above 140 and 90, so there's that grace of 5, right?
Yes. So now it's good to probably quickly clarify it for people. Now, when I'll start with the one at home. Over here, we tend to encourage people to you can buy the automated blood pressure machine that you can have at home. And I tell when patients come and see me and they have that machine, I tell them to go home and check their blood pressure for a consecutive 7-day period. They check it morning and evening, one reading in the morning, one reading in the evening. At the end of 7 days, you should have 14 readings. And what we tend to do is do the average of that reading. So if the average of the 14 readings is above 135 or over 85, then we're looking at the possibility of diagnosing hypertension. And there are different stages, which we can talk about if we have time.
Yes.
In clinic, if I check the blood pressure in my clinic room and it's
Yeah.
persistently above 140 on 2 separate occasions, then I can make the diagnosis. The reason we do that is that most times when you're going to see the doctor, there is this level of anxiety that creeps in, whether it's wanted or unwanted. And we've given that leeway because some people, the blood pressure goes up when they go and sit, just sitting down
Yeah.
in front of the doctor. It's a term
Yes.
called white coat syndrome. So that's why, what do you call it? Our organization. Mhm.
So now the next one is, please, if someone is on blood pressure drugs and the person, or let's say medication, and the person is taking Zoborodo drinks, ginger, garlic, and others, wouldn't the blood pressure be too low? This is in response to one of the videos I did, which was talking about foods that could lower blood pressure naturally, right?
Oh,
So
nice,
the person is
nice.
asking this. So can you answer?
Okay, yes. So I think what we'll say is that it's a good thing with there are natural ways to help reduce your blood pressure. I always try and explain to people that in respect of the blood pressure, I would not just say use natural remedies in isolation. It's quite multifactorial. Now, coming back to the question, yes, if you're taking that and with the tablet, there is a chance that your blood pressure may go low. Now, what is the definition of low? If your blood pressure is going to anything, the top reading, which is called the systolic, if it is persistently below 90, then that is low. That's the top reading. Then the bottom reading is the diastolic. If that is persistently below 60, then we start talking about low blood pressure. But normally, if you're using your medications correctly and you're adding these particular things, your blood pressure may not necessarily go low if you are not doing anything else. So
Yeah.
when I say anything else, I always approach things with, like I said, the multifactorial thing. If you're doing
Yeah.
healthy meal, if you're taking healthy stuff to reduce your blood pressure, I would expect you to be doing some form of exercise and eating healthy. The best way to
Yes.
know is if you're doing it, you start checking your blood pressure. So ideally, you need to have a machine at home to do the
Mhm.
7-day monitoring I talked about. If when
Yeah.
you start taking those things, your blood pressure is persistently going towards the lower side of normal, let's say the systolic, the top reading starts getting to about 100, or you start getting symptoms of feeling dizzy, then you can now seek the advice of your specialist, telling them this is what's happening, and they can work with you to either start reducing the medication you're on in a systematic manner until they think you might be able to come off it completely. I wouldn't
Thanks.
want you to just stop your medication straight away.
Thanks so much for that, Dr. Tosin.
No
The
worries.
next one is, please, can ulcer make blood pressures go high?
Oh, good one. Good question. Now, with having ulcers, what I try to explain to people is the short answer to that is no. If we're talking in relation to having high blood pressure as a diagnosis,
Yes.
or as an ailment that's being treated, a chronic disease that is being treated, I wouldn't see someone that has a high blood pressure today and say, oh, it's because you had ulcer, that's why you've developed high blood pressure. No, I won't link those as a causal agent. Now, on the other hand, if someone had persistent ulcer pains and was suffering with symptoms of the ulcer, like having ongoing indigestion, pain, or might have been having some vomiting, because of the level of pain, your body may respond by increasing your blood pressure just because you are just going through pain. So you may sit down and you might take your blood pressure at that point and it will be high. It's not that you've developed high blood pressure, it's just high because your body is responding to the amount of pain it's going through. So it's quite multifactorial. Other things that could be there is that someone that's having an ulcer, may not have rested well or slept properly throughout the night. And if you've had poor sleep, the amount of cortisol and stress flowing through your body definitely goes up, which will in turn increase your blood pressure almost naturally. So those things indirectly can contribute to your blood pressure going up. But persistently having hypertension or blood pressure, elevated blood pressure as a chronic condition is not linked to ulcer.
Oh, thanks so much. That's a very, very clear one. The final question is from Zainab. She says, do you have any information about intermittent fasting and lowering blood pressure?
Intermittent fasting and lowering blood pressure. Now, that's a loaded question. Now, intermittent fasting on its own, I think that's probably something we can sit down and discuss. It's a full topic on its own, which I think we'll get to. Yes, so there are no clear human studies at the moment, but studies done in animal studies, I will say, have shown that intermittent fasting does have the ability to help reduce blood pressure. If you go back to the second question, remember I've said help. So things cannot be taken in isolation. So as I said before, if you're doing intermittent fasting, I would naturally expect you to be eating healthy. I'd naturally expect that you should be exercising. All these things work together to help in what do you call it, improve your health and reduce your blood pressure. Now, intermittent fasting in itself is known to improve your what we call your cardiovascular outcomes. It reduces the inflammation in your body. Inflammation goes down, the effect on the blood vessels are better. It changes the cell cycle in your body, with something we call autophagy. All these little things help reduce the stress on the body. Reduce stress and output on the body reduces the blood pressure. So that is the way it works around blood pressure and helping reduce blood pressure. So, like I said, it's be something combined with other things. I would expect anybody that's doing intermittent fasting naturally to be doing some form of exercise. I mean, if there was some drug I could magically pack into something and give it to everybody, it should be exercise and fitness. Very, very honest with you. Nutrition plays a very big role, definitely. But if you think of a stool or what we call levers to help you move in the right direction, fitness and exercise plays a big role in reducing blood pressure.
Thank you so much, Dr. Tosin.
No worries.
So,
to answer that,
there's no.
Yeah, go ahead.
Yeah, finish up.
To answer that person's question a bit more, intermittent fasting, yes, can help with your blood pressure, but what will probably help better with the blood pressure is exercise. Because when you exercise and the blood is pumping around, your blood vessels tend to naturally release nitric oxide. Nitric oxide is what we call a vasodilator. It makes the blood vessels open up. And when the blood vessels open up, with the law of physics and pressure, any larger vessel, the pressure drops naturally.
Very interesting. And to add to exercise, being active, right? So exercise counts for what you're doing, then also your activity. So one needs to be an active person rather than sedentary, right? You need to
most definitely
learn to be active, working at home, walking around, doing physical work, washing, cleaning, raking, cutting grass if you can. Those type of things, incorporate them into your lifestyle, right? Try to reduce how many things you delegate to people, right? And that might help you a lot.
That is very true. I mean, I think it's good that you've touched on that term. I think what it's coined, there's a term coined for, it's called N.E.A.T, N.E.A.T, non-exercise activity thermogenesis. So there's now a new group of people that believe they just, like you said, we work in as a professional. You sit down in front of a computer for long hours of the day. You drive your car, you sit on the AC, you sit and watch your TV. They don't do any heavy activity. Then they just go to like the gym or wherever and put in 1 hour of exercise, and they feel they've covered the exercise for the whole day. I mean, it's better than nothing, but the movement throughout the whole day, something that's what we call the non-exercise activity thermogenesis, and it also contributes a lot, like you've said. So just keeping moving and keep doing things, that does help a lot.
Like it was said that Steve Jobs had his meetings walking.
Was walking meeting.
Yes.
Steve Jobs never sat down for meetings. You walk around while he's having his meeting.
Yes. So you could just do that. You could be at work, rather than taking the elevator sometimes, just take the stairs,
Most
Rather than
definitely.
sending an email to someone, just say, let me go to that office. Those things you do, little here, little there, they all end up counting. The steps add up, so to speak. So everybody, you heard that, right? So activity is important, exercise is important, weight management is important. Like Tosin and I were talking earlier, and he's mentioned obesity, right? So if you're obese, you are at a higher risk of getting high blood pressure. Tosin, can you touch on that a little bit?
Oh yeah, so I think the quick one for people is being overweight and obese increases your risk for all the chronic diseases, high blood pressure, in fact, cardiovascular disease is the whole thing, and under that you have the hypertension, heart disease, and stroke. Also, obesity itself increases your risk of diabetes, definitely almost like tenfold, and it's also now been linked to cancer as well. Obesity has been linked to cancer as well.
Mm.
So it's been linked to everything. Just one factor that can shift your liver in the direction of is weight loss. I mean, I guarantee, I know it is not the it's easy for me to sit down here and tell you lose
Yes.
weight, tell people lose weight, but it is a hard journey. Now that's why we're here. That's why we're there to support people. I mean, the way I explain to people is there are diets out there. You can go on many diets, but it's the consistency, is the mentality behind it that really matters. All diets work, and I do keto, I do other things as well, but I believe all diets work, except obviously you're going on what we call the Twinkie diet. I wouldn't advise that for anybody just eating sugar sweet anything, but
Yes.
all healthy lifestyle diets will work. It's about being consistent, being educated about what is right and what you want to do, and the little nuances to change here and there. But the main aim is to be consistent and try and get that weight shifted. I think from what we're saying, it's something that we can all obviously sit down. If questions arise, I'm happy for people to ask
Yeah.
questions, and we can dive into it deeply for them and
Yes.
explain things around obesity, things around intermittent fasting. Those are all topics that really we can really touch on, even talking about some particular diets here and there.
Yeah, that's very important. Thanks so much, Dr. Tosin. So I look
No
forward to our
worries, man.
collaboration.
Oh yeah, oh yeah. I mean, this is quite nice. I like this. This is really something we can
Yes.
always talk together and talk about topics, because we'll all talk about
Yeah.
health. It.
And it feel like the good old days. It feel like hanging out back in
Yeah,
Univen, right?
back in the days and hanging out. Remembering some days, those days may or not may or may not have involved some alcohol, but those are the days. We're
And
here now, having fun. That's good stuff.
Tosin is also a heck of a dancer. We were all dancers way back then,
Oh,
and
back
we're
in
all
those days,
active people.
it's all
So
gone. Those things just went out the window now. You just look back and like, gosh, where's your youth gone? You start living and start doing all those dancing moves again, man. It was good.
yes,
It was good.
that's
It was
one way I
good.
keep fit these days. That's one way I keep myself interested in being active, just dancing at home. I just dance and dance and dance, and it keeps me
Keep
vibrant,
going.
right?
Yeah,
Yeah.
yeah,
Yeah.
yeah. That's the main thing, man. Just keeping fit, keeping going.
Yes. Yes. So thank you
Nice.
all for tuning in. Thanks, Dr. Tosin, for coming around.
I mean, it's
So
been
you guys
wonderful, man.
kindly check his channel out. Dr. Tosin is the name of the channel. Check it out. Subscribe and ask questions. Like you said, let's get feedback, right? Ask questions. You can send emails to his address or to mine. We will both
Yeah,
collaborate on them and answer. And let us know what you think, and let us know how we can help you, because we are trying to come together to get this word out there to help people as much as possible. What actually inspired all this talk about high blood pressure for me was, like a month, 2 months ago, thereabout, a classmate of mine from secondary school we just got the news that he passed on, right? He had a stroke. So it just dawned on me that, wow, a lot of people are actually going through these things, and they need this word, right? Then they need to know what to do and how to do these things, and how simple some of these things can be if they approach it correctly. So, guys, be free to ask. Send emails if you want to be anonymous. If not, you can ask on our comments. We will definitely respond. Thank you all for joining in, and see us again soon. Thank you all very much. Have a lovely, lovely one.
have a lovely day, guys. Cheers.
All right. All right. Bye.